আসসালামু আলাইকুম। আমি ডক্টর মোহাম্মদ সাব্বির হোসাইন। আজকে আমি আপনাদের সামনে ফেশিয়াল নার্ভের অ্যানাটমি নিয়ে আলোচনা করব। ফেশিয়াল নার্ভ ইজ এ মিক্সড নার্ভ. It carries sensory, motor, and parasympathetic components. Controls muscles of facial expressions. Grossly, it takes taste sensation from anterior two-thirds of the tongue. Controls lacrimation and salivation partially. Facial nerve has nuclei and ganglia. The nuclei are main motor nucleus. The main motor nucleus, nucleus of tractus solitarius, and parasympathetic nuclei. And the parasympathetic nuclei are superior salivatory nucleus and lacrimal nucleus. Here the location of the motor nucleus of the facial nerve, and which is located in the ventrolateral aspect of the pontine tegmentum. To see more about the location of the facial nerve motor nucleus, here it is located anterior and lateral to the abducent nerve and medial to the parasympathetic and nucleus of tractus solitarius. The main motor nucleus has subdivision, and subdivision has a different function in the different group of muscle. The dorsomedial supply the auricular and occipital muscle. Intermediate supply the frontalis and corrugator muscle. Ventromedial supply the platysma muscle, and lateral supply the buccinator and buccolabial muscles. The ganglia of the facial nerve. The geniculate ganglion, parasympathetic ganglia are submandibular and pterygopalatine ganglion. The location of the geniculate ganglion. The geniculate ganglion located in the lateral part of the labyrinthine segment of the facial nerve, and here the geniculate fossa and geniculate ganglion situated in this segment. And pterygopalatine ganglion located in the pterygopalatine fossa, which is below the maxillary nerve and anterior to the median nerve. Then submandibular ganglion, which is hang on the lingual nerve by anterior and posterior root and rest on the hyoglossus muscle. Developmental background. In 25 days of development, there is 8 rhombomeres, and the rhombomeres 4, the facial nerve developed, and the motor component of the facial nerve developed from the second pharyngeal arch. Supranuclear connections. Supranuclear connection means connection above the nuclear level or above the pontine level, and the supranuclear connection of the main motor nucleus comes from the prefrontal gyrus of the frontal lobe. Here the prefrontal gyrus of the frontal lobe, then corona radiata to the genu of the internal capsule, then on the nucleus. And when it supply the supranuclear connection, the upper part supply the forehead and eye supply bilaterally, and the lower part of the face supply unilaterally.